We must mention public health because, as you say, you know, it's a very, very important part of the way things are going to move forward. Carol Brain is also very concerned that it's been extraordinarily underemphasised in the rhetoric on GP commissioning. Public health, she says, must have a leadership role in the NHS as well as in other relevant societal structures for the prevention and maintenance of health and well-being in the whole population. Are you concerned about the proposals for public health? I mean, Andrew Lansley, we know even before the election was going to be the public health secretary, wasn't he?
Well, we haven't seen them all yet. We're waiting for the white paper on public health to get some more of the detail. There are some worries about it sort of sitting partly in local government and partly in the health service, and that we have to make sure that these marry up.
And what does local government know about public health anyway, really?
Well, the problem is that when you talk about public health, people think about the drains and, you know, and clean restaurants and all these sort of things. But if you're talking about the wider health of the public, and of course, our President Michael Marmot, who is an expert on the social determinants of health, will say most of the causes of ill health, and certainly most of the causes of health inequalities, lie way outside the healthcare system. The healthcare system deals with the effects of these. It doesn't deal with the causes. And I think, getting back to people like Derek Wanless, who looked at the pressures on the health service going forward, unless we have what he called this fully engaged scenario, where people are taking an interest in their own health, where it's easier for them to make healthy choices, where we design our environment so that they can live better lives in that sense, then we are not going to reduce the ever-increasing pressures that we have on the health service that come through an aging population.
Nobody disagrees with the policy, though, does it? That public health is a very good thing.
Absolutely.
But maybe the way that it is run is going to be a concern. If local authorities are very much about having restrictions and rules and budgets, and they're not really about touchy-feely, if you excuse me saying the pun, public health provision, which is what PCTs have known about.
Well, and that's where there has to be a really good dialogue between the commissioners, between public health, between local government and between national government. They can't be absolved of their responsibility here as well. I mean, I was at a meeting last week where Andrew Lansley was saying that one of his roles is to look at every department's policy and analyse it for its health impact. I think that should be happening at local government level as well. But yes, I mean, we do have to focus on the preventative aspects, and one does worry that with this sort of split between local government and commissioning consortia, that there may be problems. We'll see what the detail of the white paper says, but we will be trying to ensure that there's a really active and effective voice for public health. There
have been quite a few questions we haven't been able to get through, and I'm sure that you'll answer them on email, Hamish and Jon. But can I ask you both now, what next for the BMA in this process? What happens now?
Well, a lot more of the same, which is trying to inform our members about what's happening, what we're doing, lobbying in terms of the input we've had with government, continue to have with government, the dialogue we have with other health-related organisations. I was talking to the RCN, to Unison, the TUC, all in the last week.
You're waiting with bated breath for the health bill, are you?
Well, I'm not sure about bated breath. I think sort of dread perhaps might be a bit more. But I mean, there will be a lot of work that we'll do through our parliamentary unit. We have a very effective parliamentary unit. I think there is still quite a lot to play for. I think there's a lot of risk, there's a lot of worry. But one of the reasons that I'm keen that the BMA maintains this policy of critical engagement is I think the only chance we've got of influencing is to do that. Now, it may well be that things will come out of the bill, or there will be real pressure points that we will need to go back to the profession and say, you know, is this acceptable, is this not? So we're not...
ballot them.
Well, I have never ruled out ballots, I've never ruled out special meetings. I think the timing of them and exactly what you're going to ask them and what you're hoping to get as results of in them, you know, we can debate. But there's been a huge amount of involvement with the profession. We're always anxious to hear their views, and we will continue to try and maintain this two-way dialogue with them through what will be very difficult and challenging times. Dr.
Hamish Meldrum and Jon Ford, thank you very much. And thank you to everyone who has sent in their opinions and questions. You can continue to send your comments into info.whitepaper@bma.org.uk. Have a good evening.